So beta plus decay. So in beta plus decay, one of the protons inside the nucleus gives off some of its positive charge and gets converted to a neutron. And it gives off that energetic positron to do that, the beta plus particle, along with a neutrino. And again, I'm not going to get into the neutrino portion. Well, of course, if a proton is going to get converted to a neutron, this must be occurring in nuclei that either, if you want to view it as have too many protons or too few neutrons, right? Since that positron is the antimatter analog of the electron, it's very quickly going to lose its kinetic energy within a few millimeters of where it's created, and it's going to annihilate with an electron. It's going to come in contact with an electron there, and they're going to annihilate each other, and all of their rest mass is going to be converted into pure energy. And we get the production of two 511 keV coincidence photons. Notice we don't call these gamma rays, right? Because they weren't produced in the nucleus of this atom. They were produced as a result of the positron that was produced in the nucleus of the atom. So 511 keV photons here that are produced. The most important example we should know about this by far is F-18, right? These are the positron emitters that we're going to use in our PET imaging. Okay, so in PET imaging, we're not imaging the positron, we're imaging the annihilation photons that are created as a result of the positron. Let's move on to talk a little bit about positron emission tomography. It uses positron emitters, almost exclusively F-18, but there are a few others out there. And here we're going to image the two 511 keV annihilation photons that are created. Those annihilation photons basically travel at 180 degrees from each other in a straight line. Not quite true because of the little bit of kinetic energy that positron had, but very, very close to being true. So we really don't need to use any collimation, right? If we can just detect the two events, we know that they were traveling along the same line. So there's no need to use collimation because we've already know the path along which that event was moving. However, collimators can be used in PET, and they were used early on, and basically they were used to minimize the number of events that occurred simultaneously so that you didn't get these false pairs of coincidence by multiple events occurring at near instantaneously in time. As our electronics have gotten faster and better, the need to have collimators in PET has decreased. So we're going to use, remember we talked about how sodium iodine really doesn't do a great job. So the detector crystals in PET tend to be things that have higher Z, bismuth, germanium oxide, LSO, GSO. So here's PET, right? Here we have that positron emitted. It ends up finding its way with an electron and the annihilation event occurs. And if I can detect this event here and this event here near simultaneously in time, I know that the place at which that event must have been emitted was along that line. Now, if I had timing electronics which were precise enough to tell me the exact time at which this occurred and the exact time at which this occurred, I could actually figure out the exact location on which this line on which they occurred, right? If they were detected at exactly the same instant in time, the event must have occurred at the location so that this distance is equal to this distance, right? And actually that timing is now coming more and more into play in terms of improving the quality of our PET scanners. But realize how difficult that task is. These are traveling at the speed of light. The speed of light is 1 meter per nanosecond. I have to get the timing of those events right down to the level of the 1,000th of a nanosecond if I want to know that event to within a millimeter of accuracy. Okay, that's a very challenging problem, but I think we'll see it incorporated in PET CT scanners in the next 5 to 10 years. Remember I mentioned that in the old PET scanners you would see collimators in there, and they were really in place so that you restricted to only be detecting events that were traveling in this direction and not so much detect events in this direction. In other words, we operated the old PET scanners in 2D mode, where they were detecting, if you will, events occurring in a single slice and not allowing 3D detection of events. That has really kind of changed. Both SPECT-CT and PET-CT incorporate the tomography of nuclear medicine with the tomography of X-ray imaging. And they do that by combining these units together, and it allows us to really precisely anatomically locate these areas of increased radiopharmaceutical concentration. If you think about it, the ideal PET or nuclear medicine radiopharmaceutical accumulates at the area of abnormality and nowhere else. So in some sense, you would get a picture of a bright spot, and that's it. And it's really nice to be able to overlay that on the anatomy, the anatomic imaging. And so SPECT-CT and PET-CT have really become the norm. In addition, that CT data set, right, that's a measure of attenuation maps, and that CT data set can be used to correct the attenuation that occurs in PET imaging, right? So as gamma rays try to escape from the body, some of them are attenuated. If we know the map of attenuation of the body, let's say from a CT scan, we can correct for that. The correction is complex because the CT scan was acquired at energies that are around the 140 or lower range, and we need to correct for annihilation photons that may be up in the 511 keV range. So the attenuation map needs to be adjusted for the appropriate